The Mental Health World Organization recorded that there has been a 13% increase in mental health conditions and substance use disorders in the last decade. My name is Naomi and I'm a psychology major. Moreover, psychology is my greatest passion, so naturally I was interested in researching music therapy. The American Music Therapy Association, which I will refer to as AMTA, states that the role of music therapists is to assess emotional well-being, physical health, social functioning, communication abilities, and cognitive skills through musical responses. This leads to their demographic benefiting a wide range from children, adolescents, teenagers, adults, people with physical disabilities, mental illness, Alzheimer's disease, other aging disorders, and even mothers in labor. This diverse demographic suggests that music therapists should have the tools and confidence to work with a diverse, rich population. Moreover, it is very vital for music therapists to be able to accommodate and understand how to work with many different ethnic cultures and groups, especially as the United States has become more diverse in the past decade, as evidenced by the influx of immigrants, multiracial and minority groups, and the increasing age gap between generations. I decided to look at the American Music Therapy Association website to analyze data and look for a niche to research. While looking at the 2021 demographics for music therapists in the workforce, I was shocked to find that the members and respondents were 88.34% white and Caucasian. Just to make sure that this wasn't just the AMTA's research, I also looked at Zapier, which is a job database, and found that out of the 25,434 reported employed music therapists in the United States, 74.7% are white. This can be concerning as the population of the U.S. continues to diversify, and leads me to ask, how much does Western influence have on music therapy curriculum in the United States, and are non-European individuals being represented through music therapy? Do European individuals feel confident giving therapy to diverse patients? Dudley Poston from PBS highlights that the white population in the U.S. has been dropping since 1950 and will continue to go down, and eventually whites will become the minority, dropping below 50% of the population in around the year 2045. Julianne Brown, a researcher for Voice, a World Forum for Music Therapy, points out that our own cultural background, usually passed on through our familial teachings, informs us on how we see the people in the world, which becomes concerning when comparing to the demographics of U.S. music therapists and then the U.S. population. Even if a therapist goes into a session with good intention, a lack of understanding of another culture could adversely affect the treatment of music therapy, could even negatively affect the patient. This increases the urgency for the American music therapy curriculum to accommodate music therapy for multiple cultures, as opposed to just European/Western. Moreover, it is crucial that there is an increase in research provided in the curriculum about many different ethnicities and cultures' music, as this will lead to music therapists feeling more comfortable to work with diverse patients, which will increase the effectiveness of therapy in the United States. Brown highlights the importance of understanding the dynamics behind cultural empathy and highlights that it can be split into three domains: emotion, cognitions, and behaviors, and that being aware of these manners with patients and how they differ cross-culturally will promote a more meaningful, culturally sensitive, and therapeutic experience. Through providing examples of music therapists using culturally diverse methods to accommodate a certain ethnic or racial group, Brown is able to highlight the positive effects in its ability to evoke emotional states more effectively than traditional Western music. The AMTA explains that music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Yet, when looking at the AMTA's approved curriculum on their website, I noticed a lack of exploring others' cultures' music, as qualifications such as quote-unquote functional piano, guitar, and voice suggest a westernized approach. Brown found through her research that the clients who benefit most from music therapy were accommodated for based on their cultural and ethnic makeup, like using an oud instrument to imitate the repetitive sounds of Indonesian gamelan music, which can be very calming for patients. Researcher of ethnic and racial representation in music therapy education, Eden Medina, surveyed 13 participants and found that there are current gaps in music therapy education when it comes to racial, ethnic, and musical representation outside of Western traditions. She also found that poor treatment care is more likely to happen to non-white patients when they are being treated by professionals who are not from or familiar with their culture, which is very concerning when looking at the demographics of the 2021 workforce from the AMTA, as it was over 80% white. Moreover, Because of this, culture and music are so interwoven within each other. Music therapists who acknowledge this link will better understand ways to interact, respect, and treat patients. I wonder how much of the U.S. Um, European slash white American therapists are comfortable slash feel prepared working with patients of different ethnicities, races, and cultures, as it makes up such a large proportion of our population. Medina highlights how inserting Euro dominant ways and ideas, when not clinically necessary, can be culturally insensitive. But with the demographic of therapists being majority European American, the chances of accidental ethnocentrism is more likely. Moreover, adjusting the curriculum to cover more cultures, music history, and current practices of different cultures, or encouraging students of music therapy to broaden their use of different cultural instruments, can lead to more effective therapy. For example, there is significance in understanding the musical history of African American music such as jazz, blues, rap, gospel, and soul to truly understand the culture built through the perseverance of the Black community. One study Medina found investigated Black Americans in music therapy as students and professionals, which discovered that participants did not feel fully belonged in their profession. There were inconsistencies in the profession reorganizing and addressing diversity in culture, and that the importance of blackness in music, health, and therapy was not fully represented or covered. If the people representing different cultures, ethnicities, and races in music therapy, as the therapist, do not feel that the current curriculum is inclusive, I've come to believe that the patients of diversity are also feeling the same, or they may not be getting the full potential that music therapy has to offer. Regarding Medina's personal study, there is more emphasis on Western-oriented music in the United States. Of the 12 participants in her study, 100% reported that they do not perceive that they are being represented racially or ethnically in their music therapy experience. When they were asked if music outside of Western traditions was represented in the curriculum, 50% reported no, while 41.6% reported very little or limited. Finally, they were asked if they felt prepared to work in cross-cultural settings outside of their preconditioned and owned Western conditions. And 50% reported no. 25% reported yes, and the other responses came along the lines of feeling not prepared to work in culturally diverse spaces, but in white spaces that we don't even in white spaces, and that they don't even feel comfortable or like they have the competent resources when faced with something different. Overall, all participants proclaimed that they perceive Western music to be the focus of music therapy education and have limited to no exposure to music outside of the Western tradition. This is more than enough evidence to suggest that there is more to be done in the advancement of music therapy in the United States, and that the curriculum should be adjusted to cover the history and practices of more cultures. I think hands-on or in-person experiences would be the most beneficial to therapists, as this allows them to fully submerge in the culture that they are trying to understand. Of course, learning about the history, traditions, and significance of different music and instruments in the culture is just as crucial to creating a safe environment that promotes cultural relativism. It also allows for therapists to feel more confident and intentional with their treatment plans. In a country that is predicted to diversify at a steady rate, it is crucial that we begin to incorporate cross-cultural studies in the curriculum. Music therapy has the power to heal, inspire, and change a person's life for the better, if done effectively. It is evident that we have allowed Western music to act as a one-size-fits-all shoe for music therapy, and it would be in our country's best benefit and interest of our patients to integrate new curriculum with diversity of music and culture.